Acute anterior uveitis, tips for management. It's not always easy to examine patients with acute anterior uveitis. Their main presenting complaint is often photophobia, pain and reduced vision. And here you can see that I'm struggling. The patient is trying to close their eyes. The lid is closed somewhat. I'm having to manually lift the lid to get a better view of the eye. And of course, this is in the patient's best interest. We want to perform a thorough examination so that we can know how severe the condition is, to actually make a diagnosis and to give them the best management. Now, even from this view, you can see that there is significant conjunctival hyperemia. The presentation is with pain, redness, sensitivity to light, reduced vision. And here you can see there is some posterior synechia. We're going to zoom in and we can see there's quite a bit of cells, probably 2+ of cells, but also some very, very small pigment. And those are not to be confused with cells. Those are iris pigment released into the anterior chamber as a result of the adhesions being formed between the iris and the anterior lens capsule, the posterior synechia. We need to break those down. We need to give the patient mydriatics, topical or even subconjunctival, to make sure that they're not left with permanent disruption to their pupil size. Now, in all patients with acute anterior uveitis, you need to perform a comprehensive dilated fundus examination. Make sure that there's no intermediate uveitis, any panuveitis or any retinitis or any vasculitis. We also need to do a OCT to make sure there's no cystoid macular edema. So this patient needs mydriatics, cyclopentolate and intensive topical steroids. Hope you found this video useful, and remember, it's not always easy.